everyone. I am Dr. Gurdeep Singh, Senior Consultant Orthopedics and Joint Replacement, Manipal Hospital, Palam Vihar, Gurugram. Today we are here to discuss a topic which is quite common but which is associated with quite a few myths. So we would like to clear these myths and make things clear about total knee replacement. So what exactly is total knee replacement? Total knee replacement is not like a liver or kidney transplant. कहीं बाहर से लाकर किसी का जोड़ आपके जोड़ में नहीं लगाया जाता. It is only the surface of the joint of the knee which is replaced. The surface 8 mm of the thigh bone or femur, the surface 8 mm of the leg bone or tibia, and the posterior surface or the inner surface of the kneecap or patella. So knee replacement has come up quite a bit in the last few years. The implants have advanced to the stage where we even allow high flexion and sitting cross-legged and knee bending to a degree which is allowed even in a normal joint. So what are the contraindications to a knee replacement? Age is not a contraindication. A patient who is fit for surgery is a patient who is a candidate for knee replacement. The main indication is pain. So it doesn't matter how old you are. If the heart is functioning well, if anesthetically you are fit for surgery, you are a good candidate for knee replacement. In younger patients, we generally try to find other alternatives. But if the knee joint is bad, you can do knee replacement at any age. So commonly knee replacement is needed in patients who have rheumatoid arthritis, who have arthritis of the knee joint after injury, or who have age-related osteoarthritis. We admit the patient a day before surgery, do routine investigations. Next day the patient is operated. There is no blood loss during the surgery because the surgery is done using a tourniquet. We give epidural anesthesia, so the patient is awake during the surgery talking to us. There is no blood loss during the surgery. Patient is kept in an HDU or ICU for observation for 24 hours. The patient starts sitting and standing and walking the next day after surgery. It's a relatively comfortable surgery. The pain is controlled with analgesics, epidural anesthesia, and the patient is made to walk as soon as possible. शुरू के 2-3 हफ्ते he walks with a walker or a stick. Once he is comfortable and confident about his new knee, he can walk without any support. सिर्फ 2 चीज़ें हम मना करते हैं. Don't squat, don't sit cross-legged on the floor. But even that is allowed with the new high flex knees. A knee replacement well done is expected to last you around 20 to 25 years, after which the implant is changed and a new implant is put. So like I said, there is no age limit. We've done knee replacement even in a 92-year-old patient, provided the patient is fit for anesthesia. In younger patients, we try to find other surgeries rather than a knee replacement. And once done, the patient is allowed all activities. You are allowed to go up and down stairs. You are allowed to walk normally. You can lead a normal life, which you were unable to do before the surgery due to pain. Thank you.